I chose Catherine Clark's office for a few reasons. I had been living in Boston for about 10 years before, working at Boston Medical Center. I'm on faculty at Boston University. So she's from just outside the Boston area, and it made sense from that perspective. On issues, we also are closely aligned. One of her main issues is focusing on the well-being of families and children. As a pediatrician, that clearly resonates. And finally, she also is in a leadership position. I was really interested in learning about the politics of how policies are made.
Well, we at that time were, number one, all physicians, and we were told that we could interview at any office that, would be interesting to work in. And in that year, most of the fellows really actually went to committees where they thought the legislation that Clinton was developing would be, essential. But I wasn't so interested in that. I was interested in working with a politician who saw themselves as a generalist, because I was a general internal medicine person. And as I looked through things, George Mitchell turned out to be somebody who had the reputation of meeting with any constituent in his state, even if they were homeless. And I thought this would be a great place to work. And then as I dug a little bit deeper, I began to realize, but he's also the Senate Majority Leader. I bet you that his office is going to have something to do with the way in which the Clinton health plan is going to be structured. So I interviewed there and was very fortunate to be selected.
So I was a public health person. I was not a clinician. So that put me in a unique place. I interviewed at 10 places and didn't get an offer. And I went home at Christmas time and I was like, should I even bother to come back? But everything worked out for the best because I got in a great office where public health was very much appreciated and ingrained in a lot of the policies that were going on through the office.
I chose Representative Lauren Underwood's office for many reasons. Representative Underwood is a nurse. She was on appropriations. She's so detailed as it relates to policy and how policy truly impacts those that she serves. And so I knew that opportunity I could not pass up. She just a great mentor, and just with her health background, being a nurse, and her true focus on maternal mortality has been, was very important to me. And that is definitely an issue that we deal with in the state of Alabama.
In my year, 2002, everyone was, my colleagues were looking to work on Medicare and prescription drug plan programs. And that was the last thing I wanted to do. So I ended up on Senate Health Committee, the majority side. At that point, Senator Jeff Bingaman from New Hampshire was chair. And I told him that there were certain things I wanted to do and I didn't want to do Medicare. But they gave me just about every infectious disease related topic.
I ended up with a muckraking left-wing committee in the House, and I met it, and I ended up with a senator whose principles I basically disagreed with all the time, who I got to respect enormously, Bob Dole. I wanted to work on the other side. I thought it would be useful for me to work with someone who was not of my political persuasion, but I would learn more that way. He was also in the minority at the time, and I figured I would have more access to more interesting things by being a bigger fish in a smaller office than if he were a majority in the majority.